How to read a chest x-ray. Brought to you by the Respiratory Tutor. As a respiratory therapist, a key skill you will need to develop is to be able to read a chest x-ray. Let's go through the ABCs of reading a chest x-ray. Here's our patient's chest x-ray. Before you start to read a chest x-ray, you want to assess the quality of the x-ray. If the image is poor or suboptimal, you may incorrectly diagnose or inappropriately be reassured because of the quality of the image. You can use the mnemonic PEER to assess the quality of the film. Projection. When looking at a chest x-ray, you'll want to consider how the image was taken. Was the image taken anterior-posterior, AP, or posterior-anterior, PA? Lateral, supine, or standing? The patient's position in relation to the camera affects how organs will appear on the image. Inspiration. Ideally, a chest x-ray will be shot on an inspiration and the patient holding their breath. Patients who are short of breath may find this problematic. If a patient's intubated, the radiographer will time their shot with the patient's ventilator breaths. You should be able to count 9 to 8 ribs on the x-ray. If an x-ray is acquired during expiration, there will be little air in the lungs and the density will look increased. The diaphragm will be up, causing the heart to look bigger, and the lung bases will be obscured. Exposure. Depending on the penetration of the x-rays through the body, determines the exposure of an x-ray. If an x-ray has good exposure, the vertebrae will be just visible behind the heart. You're less likely to see an under- or overexposed chest x-ray because radiographers can make adjustments to optimize the image when acquired. Rotation. If you miss a patient is rotated, certain appearances on the x-ray may be misleading. The spinous processes of the thoracic vertebrae should be midline. They should create lines that are equidistant from the medial ends of the clavicles. If the spinous processes are closer to one clavicle than another, your patient is probably rotated in the image. Now you know how to assess the quality of an x-ray. Let's go back to our patient's x-ray and discuss the ABCs of reading an image. A is for airway. The green marking highlights the patient's airway. The red marking shows you the bifurcation of the main bronchus into the right and left. This is usually located at T3 and 5. You want to see if there are any lines or tubes in the airway. Evaluate if the trachea is deviated. The endotracheal tube has been highlighted in pink. You need to check the placement of the endotracheal tube and make sure it's 2 to 3 centimeters above the carina. B is for bone and soft tissues. Bone is the whitest areas on an x-ray, and air is black. The bones have been highlighted on the right side of the chest x-ray. T1 is located where the first ribs meet. This is identified with a green circle. Next, you want to scan all the areas around the bones and the bones themselves to see if there are any fractures, lesions, or swelling. Fat, muscles, and fluid are a grayish color on x-ray. You can see the soft tissue highlighted here in orange. C is for cardiac. Here you see the heart. You need to identify the heart borders. The heart should not take more than 50% of the diameter of the chest. D is for diaphragm. You want to see if the diaphragm is flattened or if there's any free air under the diaphragm. E is for effusions. Next, you want to look at the costophrenic angles to assess for effusions. If the angles are blunted, this is suggestive pleural effusions are present. F is for the fields of the lung. You want to scan the lung fields for infiltrates, masses, consolidations, or pneumothoraces. You need to check if there's any thickening of the fissures. G is for great vessels and gastric bubble. You need to check the aortic size and shape and the outlines of the pulmonary vessels. The aortic knob should be clearly seen. The gastric bubble should be clearly seen and not displaced. H is for hilum and mediastinum. Next, evaluate the hilum for lymphadenopathy, calcifications, and masses. The left hilum is normally higher than the right. Check for widening of the mediastinum and for tracheal deviation. I is for impression. Now that you've assessed the quality and systematically reviewed the x-ray, you're ready to synthesize your findings and create an impression of the image.